Okay, so if you're watching this video, either you're finishing up your hair transplant or you've just had your hair transplant surgery, and I'm very excited for you to see the results. This video is going to help you maintain the best aftercare instructions, and we'll start by talking about the recipient area. So the recipient area where the grafts have been placed, that could be the frontal area or the crown. We're going to start with the cleaning instructions for that area. So you have been provided a table with all of this laid out on it, but this is just to make it easier for you so I can take you through the best form of aftercare. Now with the recipient area, the first 4 days we're going to spray with saline solution. This is provided for you in a spray bottle, and I normally recommend you keep a 10 centimeter distance, give it a few sprays on either side. Now if that's frontal area, cover the whole area at the front, and the crown, you want to make sure you've got a nice even coverage. The saline solution is important to make sure the grafts are well hydrated and clean, and you'll be doing that every half an hour for the first 4 days. The important thing to bear in mind is you don't have to do this overnight, but if you do wake up in the middle of the night, feel free to give it a few sprays. So counting day 1 as being the day of the surgery, we're going to do that for 4 days. So after 4 days, we're going to start washing with jug mixture wash. So baby shampoo and lukewarm water mixed together in a jug. And the best way to do this is to pour that mixture, if it's a frontal area, just behind the grafts, not directly onto the grafts, and let it flush through that area. So you're rinsing out all of that debris or sort of dead skin and scabs that are starting to shed gently at this stage. And you're then going to rinse it out with clean lukewarm water. Let it dry on its own. Don't use a hairdryer or a towel on the recipient area itself, but you can of course wipe the front and the back as long as you're not touching where the grafts are. You would do this for 3 days. So just to recap, 4 days of saline solution spray, 3 days of using the jug mixture wash. Okay, that will take you up to a week post-op. So first day you can touch the grafts very gently with your fingertips. Normally advise that you get some baby shampoo on your hands, rub it into a lather, and gently dab on the recipient area where the grafts are. Okay, whether that's frontal or crown. Now you're not going to rub at this stage, you're just going to dab it on and gently rinse with a low pressure shower head. You do this from day 7 to 14. Okay, so just to recap, 4 days of spraying, 3 days of washing with a jug, a week of then dabbing with baby shampoo and gently rinsing in the shower with low pressure. At 2 weeks, everything should have healed. So whatever's left on there at this stage is just dead skin a lot of the time. So I want you to give it a good massage, gentle in the shower, and just start to clear off that dead skin. Don't pick at any scabs. Let them gently fall on their own. But it's important that you clean the recipient area and you maintain clean, healthy skin at this stage. And after that, you go back to your normal routine. You can go back to using your usual day-to-day shampoo. If it's a medicated shampoo, make sure you discuss that with your surgeon beforehand. The next part, the donor area. Bandage that we apply in most cases, that can be removed day following the procedure. So the next day after, in the morning, I recommend that you gently remove the bandage, peel it from one side to the other. It is sometimes common to see a little bit of bleeding at this stage. I normally recommend that you apply a bit of firm pressure with gauze for a few minutes, and that should stop any bleeding. Important to clean the donor area once a day, and it's safe to touch from the following day post-op. It will be a little bit tender, so just be careful with that. And normally recommend you get some baby shampoo, apply it to the area with a sponge, and gently rinse with a jug. And then you're able to pat it dry and apply a thin layer of antiseptic cream, which we'll provide for you once a day, only on the donor area at the back of the head for a week. Okay, and when you get to day 7, you're going to be rinsing the recipient area in the shower. At the same time, you can wash the donor area as well. And you maintain that up until 2 weeks. And after 2 weeks, you go back to normal routine. Now, between days 7 and 10, you'll start to notice a lot of the scabs from the donor area also starting to shed, and that's quite normal. So don't be alarmed if you see that. And don't be alarmed if you see bits of hair attached to the scab. That's also a normal occurrence. Finally, then coming on to your sleep and medication. So in terms of sleeping, I normally recommend that you have an incline of about 45 degrees. So it doesn't have to be fully straight or fully flat. It's somewhere in between, just to allow gravity to bring down some of the swelling. We provide a neck pillow for you, which you should use to keep your neck in line with your back and sleep like that for the first 5 to 7 nights post-procedure, just to make sure you're not rolling around. Now, if it's a crown procedure, important to make sure that there's a good gap between your headboard or where you're sleeping and make sure there's no abrasion overnight. And then medication, your surgeon will go through with you specifically, but I normally give painkillers to my patients with paracetamol to begin with, and codeine if you need something a bit stronger. And most patients don't need anything more than paracetamol, and they're absolutely fine with that. We'll also give you some antibiotics to reduce the risk of infection, and some mild steroids to reduce the swelling. That will keep the swelling down to a minimum. Again, this will be detailed on your post-op aftercare sheet, and the surgeon will go through that with you on the day as well. If you have any questions, do reach out to your dedicated patient advisor, and they can put you on a call with the surgeon to discuss this further. I hope all the recovery goes well. If you have any questions, reach out to us.